Well, thank you for joining us today for our roundtable. We have a wonderful group of experts. I'm delighted that you're all here to discuss the fear status of the animal and how that interacts with pain management. Let's get started by going around the table, and we'll introduce ourselves as we go. I'm Dr. Kathy Gloyd, President of Alleviate DVM. Joyce?
I'm Joyce Logan with Zoetis. I'm the medical support for our chronic pain products, dogs and cats.
Okay. Tammy?
Tammy Grubb at Washington State University, and also a consultant with pain management and private practice.
Right.
Ralph Harvey, anesthesiologist, University of Tennessee for many years, and now chair of Veterinary Advisory Group for BioTraceIT Corporation.
Okay. Margaret?
Margaret Gruen, behaviorist, veterinary behaviorist, and at North Carolina State University.
Great. And Mike?
Mike Petty, and I am a private practitioner, and I own a pain management clinic in Michigan.
Great. So you can see that all of our panelists are qualified to discuss pain, but also have different pieces of the puzzle that you bring and that you represent. So we're going to start out with a very basic question, and Ralph, I will turn that to you and address that, which is, let's define pain for what we'll be talking about today.
Okay, the definitions are important, and the International Association for the Study of Pain, the IASP, has a formal definition that fits quite well. They say that pain is both a sensory and emotional experience associated with actual or potential tissue injury or expressed in those terms. Now, that definition was intended to represent pain in humans, but it applies so well to our veterinary patients as well.
And so the emotional component is of equal importance to the physiological component of pain, and that's kind of how we get into talking about fear-free and pain-free. One of the things I should say is that we'll start out with is that we'll use the term acronym FAS, for fear, anxiety, and stress, so we're not having to say that every single time that we go through. If we can get FAS out on a reasonable basis, is how the two are intertwined. And Mike, I like your way of looking at it.
Yes, I see fear and pain as two sides of the same coin. You cannot have one without the other. And anyone who's experienced, especially an accidental injury that then is hurting 24 hours later, you have emotional feelings about it. Why did I do this? I'm so stupid, and so on. And it's not self-recrimination. It's actually because the pain and fear centers or emotional centers are adjacent to each other in the brain.
Right. Other comments that you have about what you see with that intertwining and how that image?
Yeah, I think that we sometimes diminish the impact of pain, and one of the other definitions in human medicine is pain is what the patient says it is, and that's true in our patients as well, and it really impacts some more than others, and so we can't just paint all of our patients with the same brush and say this isn't painful. A Labrador would tell you nothing's painful, and then a Husky, we discussed Huskies before this interview, Huskies say everything is painful, and we have to look at the patient, use that definition, and then ask the patient by doing good pain exams.
But we really don't have evidence based, right, Margaret, for the difference in breeds, the difference in species, the difference in individuals.
Right, there's a lot of individual variability within a breed for sure, and we did a survey study that looked at veterinarians and general public's ratings of pain sensitivity in different dog breeds, and it really was remarkable that veterinarians rate dogs as having very divergent pain sensitivity. If you ask them to go from not at all sensitive to most sensitive imaginable, Huskies and German Shepherds end up very high, Labradors and Pit Bulls end up very low. But that may be behavioral, that may be related to anxiety, that may be, a behavioral response. But what was most remarkable about that is that the variance among veterinarians was very low. In the general public, we had a very linear relationship, but the variance was wider. In veterinarians, we all agree about these, which suggests to me that we are passing this along, and we have no real biologic basis for it, but very strongly held beliefs about it.
Mm-hmm.
When we talk about biology of pain, there's, about a year ago, an article came out about this woman in Scotland, and her name was Jo Cameron, and she has the inability to feel pain. She has fallen on cement face first and knocked her teeth out. She's had fractures. She's given two childbirth twice, and one of her favorite things is to pull stinging nettles with her bare hands because she loves the tingly feeling. And so she just has the inability to feel pain. But what is more significant is she has never felt fear or anxiety in her life. And so you can take away one, the other one isn't there.
That's powerful. That's an N of 1 that's very powerful.
Yeah, it is. Having a Labrador that has everything wrong with it, I'm very sensitive to the fact that he's in a lot of pain. He doesn't show pain to the point that you're talking about. But I know he's in pain because of the physical things that are going on. So how do we convince ourselves that the pit bull or the Labrador that's not showing pain needs to be treated equally to that husky or mini pin or whatever the breeds are that are a little bit higher, should I say higher strung?
Yeah, and cats. Can I make sure cats are in there too?
I thank you.
Cat necklace. And I want to throw this to the behaviorist as well, because we hear that a lot, that they're not showing pain, but I think they are showing pain. We just have to learn. You clearly do recognize that your dog is in pain, so you are seeing it because you're able to figure it out. You're reading the signals that your dog is sending out. You're able to understand it. And again, I want to have Margaret comment on that. But I think if we can teach our clients to recognize that ways that they can recognize that their animal's in pain, and they do recognize it, they just don't realize what they're seeing. So they are telling us they're in pain. We like to, right, we say all the time that they don't show it, but they do show it.
Right, because it is that behavioral impact. When you ask an owner, is your pet in pain, they say no, unless that animal came into your clinic for pain, they say no.
Which is rare.
It's exactly incredibly rare, because we're asking the wrong question. It's not about the pain, it's about what the pain does to that animal, right? It's how that animal is impacted, and then the behavioral manifestation.
Yeah, because when we ask if they're in pain, I think that what owners are picturing is something very different from what we're picturing. Yes. So we're picturing, in the cat, is it having trouble jumping up? Is it having trouble jumping down? Do you see these changes? And they think, oh, is it screaming in pain? Right? They think about this very different version of pain. So when we just say pain, we get a no. Yeah. If we ask more specific questions about behavior, we might get the yes, that we need to help that animal.
And on top of that, if you ask a client, is your pet in pain, and they say no, you've lost the battle, because you can't get past that point without them feeling stupid. So you really need to have them tell you the animal's in pain, and the best way to do that is through surveys.
So asking if their animal is in pain is really the wrong question.
It's the wrong question. You have to look at their survey and say, wow, you're telling me your pet's in pain.
Yeah.
Because of the changes in behavior, and as this animal's person, you know your dog's behavior better than anyone else ever would. You see that behavior, and we can help the clients recognize a change in behavior over time, in part through collecting meaningful video clips and getting to know that animal better and seeing that change that can be very dramatic over 6 months or a year or 2 years. The client having seen that behavior every day, because the progression of sometimes chronic disease is slow, the deterioration in quality of life is slow, the deterioration in ability to perform and function in normal fashion is a slow transition that clients sometimes don't appreciate unless we can remind them of the previous behaviors.
Well, let's talk a little bit, and I don't want to leave out cats, because those of us that are cat people realize that we see those same changes that are very subtle in cats. And again, I guess that most cat owners then don't have a real clear definition of pain in cats.
Yes, I would agree.
Right?
Yep.
So let's talk about diagnosing pain, because that is the crux of what we're supposed to be doing as veterinarians. And if our owner is not seeing those changes because they are so subtle through the days, what are the best tools that we can use to diagnose pain?
So whenever I'm interviewed and someone asks me what the hardest part about treating chronic pain is, I always tell them diagnosing it. Because once you have a diagnosis and once the owner understands that, then you can move forward. So luckily, due to the work of people like Margaret, lots of new things are coming out. I think the visual scales are really priceless. Zoetis has sponsored some scales online that actually shows difficulties of movement with cats. These are the kinds of things that you can show your clients, and I actually have a poster in my waiting room of diagrams that I had commissioned myself of cats having difficulty doing certain things. It's just in my cat room, and every week 1 or 2 people say, my cat doesn't do this. What is this an issue, right? So it's about the behavior, and it's about getting that behavior in front of the clients and having them recognize their cat's doing this. What does it mean?
And in cats in particular, the facial grimace scale that now has been validated, the excellent accompaniment to behavioral changes in cats in particular, as in humans. The facial grimace scale is very powerful, particularly perhaps for acute pain, for post-operative pain. It's very useful. If we can integrate that with behavioral changes, then many of us are now feeling that the appreciation, the assessment, the subjective assessment that we rely on of changes in our patients, the feeling is that the assessment of pain in cats may now be easier than in dogs, or more meaningful than in dogs, particularly for acute pain.
I want you to talk about pain scales too.
Sure, but I was just going to say that I think that that's a place where FAS becomes really important, because we can't do an accurate diagnosis if an animal is so anxious and fearful that they are not able to display any of the behaviors or respond to even palpation in the way that would help us understand and localize pain. The grimace scale is great for cats because you don't have to touch them, do anything. So,
Yeah, and the thing about the grimace scale that I found fascinating is maybe as veterinarians didn't always appreciate it. That grimace scale is used so many species. It's used in babies, it's used in laboratory animals, it's used in production animals, in pigs and rabbits and horses, and yeah, so the fact that we're just getting around to it in companion animals is great.
And clients you can use these scales as a benefit to the client. Like, so for the acute one, the Glasgow cat pain scale, there's 2 facial expression scales, and it shows for muzzle position and ear position. Whenever I do a potentially pain-inducing procedure in a cat, or there's been an injury, I actually print that off, and I just cut out those pictures and I send it home, and I said, if your cat's doing the 2nd or 3rd one, you need to call me. And people do, and and then we intervene. So people cat owners are very smart about this. It doesn't take but like 10 seconds to teach them what a painful cat looks like. They'd never have recognized it beforehand.
Right, exactly. With talking about, you bring up when you're talking about a procedure, when you're contemplating a potentially painful procedure, what you have to think. So we go back to the definition of pain, but I think we also have to think about acute pain, or that the animal may be in or that we are causing, versus the chronic pain animal, whether it be dog or cat or horse or whatever. And evaluation of those animals and how the fear-free fits into both of those. And so let's take the example of an acute pain, either a procedure that you are going to do, or maybe it's an emergency, and you know that this animal is probably going to be very fearful and very painful. And what are the steps that you are taking that should be going on in your mind, I guess, in terms of managing those 2 sides of that coin?
well, I think one is just assuming that it's going to be painful. If we think that it's going to be associated with pain, we should treat as though it's associated with pain. Even if we look at the Labrador and say, well, it doesn't seem that painful. For certain procedures that we know are painful, we should treat them as such. So I think that that's one piece, because I think that some animals may be so tense and so anxious that we can't appreciate whether they're uncomfortable or not, and we should give those animals the benefit of the doubt.
This is a focus point in the 2015 updated version of the American Animal Hospital Association's guidelines for pain management in dogs and cats. And their comment, the task force members' comment, is that we know that surgical procedures will be painful. So we should preempt that with analgesics as a part of our management from the very first. And I think we all would believe that fear, anxiety, and stress now is a part of that also, if pain is a part of it. And we often will preempt that with anxiolytics, or an appreciation, a sensitivity to that animal's anxiety and even aggression that could be another part of the FAS because aggression is often triggered. So for the welfare of our personnel and ourselves, as well as for the patient and the client, we preempt those potential problems. And the task force members said that we can predict that a surgical procedure would be painful. So we should always, in their words, use local anesthetic, for instance. We should always use a multimodal approach.
I absolutely agree, and I think a message to veterinarians too is it is so much easier to prevent pain than to chase after it. And in my clinic, every possible painful procedure in a cat gets Symbidol, the long-lasting buprenorphine product, and even though it's considered a moderate opioid, that in combination with other stuff, it works so well that all but the most excruciating pain is covered. So if you go ahead and you try to do this beforehand, you try to anticipate and realize this has got to hurt, and you treat it beforehand, it's just so much easier.